It's 10:30 now, Chairman Boyd. I think we can get started.
Thank you, Denisha, and good morning. Can you hear me, Denisha?
Yes, I can.
Okay, fine. Would everyone that's on the call, if you're not speaking, please mute your mics and then unmute when you're making a motion or speaking. We will have the services of the hearing impaired interpreter throughout this call this morning. And first of all, I'd like to ask Denisha if she would call the roll, please.
Yes, yes, I will. First, Norman Boyd.
Here.
Roger Folsom.
Here.
Elena Cummings.
Here.
Russell Crutchfield.
Present.
Anthony Williamson.
Here.
Russ Childers.
Here.
Kenneth Davis. Kenneth Davis. Mark Trail.
Here.
David Cruz.
Here.
Thank you. That concludes the roll call.
Thank you, Denisha. And with that, we have a quorum. We have 8 of the 9 members, and thank you very much for attending and welcome to everyone. With that, I will call the meeting to order. And we have a rather brief agenda this morning. We do have one item that we will be voting on or asked to vote on for final adoption. We'll hear Commissioner's report and get a legislative update. And those are the main topics that will be on our agenda today. With that, I'll move to the first item on the agenda, and that is the approval of the minutes for the June 11 teleconference meeting that we held, and ask Elena Cummings, our secretary, if she has read those minutes and would recommend approval.
Thank you, Chairman Boyd. I have reviewed the minutes from the June 11th meeting and find them to be in order as written and would make a motion to approve.
Do I hear a second for that motion?
Crutchfield, second.
Russell Crutchfield has seconded. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, the minutes are approved. Thank you, Elena. With that, I'll move to the Commissioner's report and ask Commissioner Berry to bring us up to date. Thank you.
Good morning, Mr. Chairman and members of the board. Thank you for your participation today. I think the most important point that I wanted to raise this morning was acknowledging the governor's tour of the state of Georgia, and it was the Wear a Mask tour. He traveled to, I believe, 5 or 6 different cities last week. I think as you as board members may get questioned about what is the most appropriate way to help with the COVID pandemic that we're faced with, it's following the governor's lead of wear a mask, wash hands, and social distance. That message has not changed. They flew around the state with Dr. Toomey and Ryan Loke and met with various community members to reinforce that message. And I was with Dr. Toomey yesterday who reinforced that with me as well. So I hope that's just some, at least some talking points as you get asked from a department board oversight position that may be able to be helpful. Follow the governor's guidance on wearing the mask and washing hands and social distancing. The other 2 items that I wanted to focus on were the end of the General Assembly that occurred about a week and a half ago. And I just wanted to recognize the work that Brandi did. It was a very condensed end of the session, but very, very, very intense. A tremendous number of phone calls, of pieces of legislation that you'll hear from Brandi about that impacted the department. And I've gotten several text messages and emails from members of the General Assembly, including our chairman, Parrish on the House side and Dr. Burke on the Senate side, recognizing just the work that Brandi and her team did. So wanted you to be aware of that. And also recognize just an incredible piece of work that Melanie Simon and Joe Hood did as it related to some legislation that Sharon Cooper and Senator LaHood carried as it related to assisted living programs and personal care homes. I think some of you may have seen that Joe made the newspaper, but Melanie did all the work. But Joe was in the paper and with Sharon Cooper for the bill signing, and was with the governor, and just really want to recognize just a great effort on their part. The governor couldn't have been more pleased to sign that piece of legislation. And I think that that's a great step in the right direction. So just a great job on their part. We are continuing to work very closely with the governor's office. As many of you are aware, the numbers in Georgia have gone up a little bit, and so we're working very closely on monitoring that with public health and looking at on a daily basis, looking at hospital capacity, looking at ICU beds, looking at ventilator usage and everything else, and still have daily calls with the governor and his staff that DCH is a partner in. They have been incredible, keeping an eye on all of this and relying on their health experts to help inform decisions. And it's an honor to be a part of that and to work with his team on all of that. So with that, I can answer any questions, but I'll turn it back over to you, Mr. Chairman. And again, I can answer questions if anybody has any. Thank you.
Thank you, Commissioner. Any questions, comments from the board, please? Hearing none, I would, on behalf of the board, I'm sure I add my thanks to Melanie and Joe for the work that they did on the senior living bill. That was certainly a good outcome, and we really do appreciate that kind of work. Thank you. Next on the agenda, the one item that we need to address for approval today is medical care management organization direct payments to physician faculty groups affiliated with teaching hospitals. We've had the public notice. We've had a chance as a board to review the input that we received back from the public notice, and ask Kim Morris to take us through that prior to our vote, and we'll answer any questions anyone has at that time. So go ahead, Kim, please.
Kim, you may be on mute.
Good morning. This is Kim Morris. Are you able to hear me now?
Yes.
Okay. Okay. Good morning, Chairman and Commissioner. I'd like to come back before the board as a follow-up to the briefing that was done at the last board meeting. Just want to give a little bit of background. What DCH is presenting is pending Medicare and Medicaid approval for effective date of July 1, 2020. We propose to implement a new direct payment program for our Medicaid managed care organizations. This would enable us to provide an annual lump sum direct payment to our physician faculty groups affiliated with teaching hospitals. We had public comments that were held on June the 16th, 2020, and there were no oral comments received. We had a due date for the written comments on June the 23rd, and we received 8 written comments. The written comments came from Jonathan Lewin with Emory University, A. James Bazinski from Wellstar, Brian Church with Phoebe Putnam Health System, Robert Cross, Piedmont Healthcare, Earl Rogers with Georgia Hospital Association, Bryce Gartland, Emory Healthcare, Matthew Hicks, Grady Health System, and Katrina Kiefer, Augusta University Health System. All of the 8 individuals that were identified, the written comments, they recommended the DCH board approve the Medicaid care management organizations direct payments for the physician faculty. We received 3 comments from providers regarding the lump sum direct payments, and I'll summarize the comments. The public notice stated participating physician groups will receive increased Medicaid funding via an annual lump sum direct payments. The three comments that they listed had to do with the time frame in which they would receive the payments, and recognizing that it would be up to 24 months before they would receive the payment. And that was not the intent of DCH for the providers to wait 24 months to receive their payments. So DCH will implement a semi-annual interim payment. So we will be making that change to the preprint. The second comments that we received, and this was from two of the commenters, they wanted DCH to consider removing the restrictions that participating in the primary care physician enhancement rate would not be eligible for the CMO Physicians Direct Payment Program. And so after reviewing that and looking at the calculations, DCH has agreed to remove the restriction, and we will allow providers who receive the PCP enhancement to participate in the CMO Physicians Direct Payment. Those were the only comments that were received. Are there any questions from the board?
Mr. Chairman, this is Mark Trail. I have a quick question. My question is, do the modifications that the department's recommending require that we post this for comment again, or will we be able to do a final adoption today?
My understanding is that we would be able to do a final adoption, but I'm not sure.
Mr. Trail, we'll double check on that and we'll get back with you. We could do a final adoption, and then if something changes, we'll bring that back, would be my recommendation, to do the final adoption. And then we'll do our due diligence. If that changes, then we'll bring it back to the board.
Thank you, Mr. Commissioner.
Thank you, sir.
Okay, so with that being said, DCH would request for final adoption from the board.
Mr. Chairman, will you entertain a motion to that effect? Have we lost our chairman?
Let's go to Vice Chair, make the motion.
Yeah, hello?
Great.
Yeah, hello?
You're back.
Okay, I seem to be the host, or it keeps muting me, and I don't seem to have control of it myself, but I'm asking for, is there a motion for approval for final adoption based on the commissioner's comments?
This is Mark Trail.
Is there a second to that motion?
Roger Folsom, second, Mr. Chairman.
Yeah, Roger, thank you. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the motion is approved for final adoption. Thank you very much, Kim. Thank you for addressing the comments from the public input. Thank you.
You're welcome.
With that, we'll move to the next item on the agenda, and that's a legislative update, and Brandi Sylvan will give us that update today. Thank you. Please proceed.
Thank you, Mr. Chairman. Good morning, Chairman Boyd, members of the board, and Commissioner Berry. My name is Brandi Sylvan, and I serve as the Director of Government Relations. I appreciate the opportunity to present to you today an update on the 2020 legislative session. To say it was the most unique session of my career would be an understatement. On March 13th, the General Assembly suspended the legislative session on day 29 in response to the COVID-19 pandemic. Uncertainty loomed about whether or not the legislature would return for anything other than passing the fiscal year 21 budget. But on June 15th, the General Assembly reconvened, and as Commissioner said, it was a very fast-paced final 11 legislative days. DCH tracked close to 200 bills this session, but today I will provide a high-level overview of bills that received final passage and will require action by the department. Governor Kemp has until August 5th to either sign or veto any passed legislation. Bills on which he does not take action will become law following that date. House Bill 888 addresses the practice of surprise billing. Legislators have been working on passing this type of legislation for several years, and its passage is the product of many long conversations between advocates representing insurers, providers, and consumers. Broadly speaking, surprise billing, also known as balance billing, refers to a patient unknowingly receiving care by an out-of-network provider at an in-network facility and being billed for the full cost of this service. House Bill 888 provides consumer protections against surprise billing and details billing and payment requirements for both insurers and providers in both emergency and non-emergency situations. The bill also establishes an arbitration process for payment disputes between providers and insurers. These consumer protections will apply to members of the State Health Benefit Plan, and this bill becomes effective on January 1st. House Bill 946 is one of several bills introduced this year to address the practices of pharmacy benefits managers, also known as PBMs. House Bill 946 and Senate Bill 313 are identical bills and both received final passage. So I will be discussing them both together, but they did both pass. These bills will apply to the PBMs contracted to manage pharmacy benefits for Medicaid, Peach Care for Kids, and the State Health Benefit Plan. Many of the requirements in House Bill 946 and Senate Bill 313 are intended to improve price transparency and limit practices which may adversely impact patient access to or cost of medication. PBMs will be required to report to the Commissioner of Insurance all drugs that were reimbursed at least 10% below or above the national drug acquisition cost. For state-administered health plans, PBMs must charge the plan the same amount for a prescription drug as it pays a pharmacy for that drug. PBMs will be required to apply any third-party payments or coupons for drugs without a generic equivalent to the insured's out-of-pocket maximum, deductible, or copayment. This is not a comprehensive review of that bill, but those are some of the highlights that we'll be applying to the programs at DCH. House Bill 987 is the bill that Commissioner Berry referenced that had significant participation from DCH. We worked very closely with Chair Cooper, who was the bill sponsor, and industry advocates to work on this bill. It makes comprehensive changes to requirements of long-term care facilities. The bill increases penalty amounts imposed on facilities for violations and imposes a mandatory minimum fine of $5,000 for a violation which leads to the death or serious physical harm of a resident. For assisted living facilities and personal care homes with 25 beds or more, House Bill 987 puts in place requirements for minimum staffing ratios, staff training, a demonstration of financial stability, notice to residents of impending bankruptcy, property eviction, or change in ownership. In addition to these changes, these types of facilities that wish to provide care to residents with Alzheimer's or related dementias will need to seek a certificate from DCH authorizing them to provide memory care services. This certificate will be in addition to their existing license and places additional staffing and training requirements on the facility. Following the return to session in June, additional language was added to the bill to address the COVID-19 pandemic. Nursing homes, assisted living communities, and personal care homes with 25 beds or more are required to inform residents of confirmed infections, maintain a 7-day minimum supply of personal protective equipment, and include infectious disease control as part of their disaster preparedness plan. As Commissioner said, Governor Kemp has already signed this bill into law, and it became effective on June 30th. House Bill 991 creates the Healthcare Transparency and Accountability Oversight Committee. This committee is given the authority to review the performance of state healthcare plan contractors and prepare recommendations regarding contracting, transparency, and oversight to applicable agencies. The committee can also prepare recommendations for legislation to the General Assembly. House Bill 1114 provides for the extension of postpartum Medicaid coverage from 60 days to 6 months. The bill also provides for Medicaid coverage of lactation services. Appropriations were included for this extension of coverage in the fiscal year 21 budget, and DCH has granted the authority to submit a waiver request to the Centers for Medicare and Medicaid Services to implement this change. House Bill 1125 requires the state health benefit plan to provide additional coverage for individuals at high risk for breast cancer. High risk classification is defined in the bill, and these members will be able to access screenings beginning at age 30. Coverage for these members will include an annual mammogram as well as a secondary advanced screening such as an MRI. Senate Bill 482 establishes an advisory committee to make recommendations regarding the development of an all-payer claims database. The intent of this database is to collect and analyze health claims data from all health and dental benefit plans in the state for the purposes of examining cost trends, measuring utilization of services, identifying health disparities, and improving coordination of care, among other identified purposes. The Commissioner of Community Health or his designee will have a seat on this committee. If the committee is able to identify funding for the development of this database by January 1st, 2022, it will become operational on January 1st, 2023. In addition to these bills, the Senate created 2 study committees this year that the Office of Government Relations will be monitoring. The first will examine the practice of midwifery in Georgia and regulations placed on this practice. The second will discuss the need for surgical smoke evacuation systems to be used during surgical procedures for the protection of healthcare workers. The Office of Government Relations will be working closely with divisions throughout the agency over the coming weeks to review bills, understand implementation requirements, and ensure implementation timelines are met. We will also monitor the actions of Governor Kemp as it relates to bill signatures and vetoes between now and August 5th. Finally, I would like to take a moment to recognize the exceptional team at DCH for their support throughout this session. There is significant demand for bill review and divisional feedback, and our subject matter experts consistently prioritize responsiveness to our office despite the continuing demands of their primary job duties. I would also like to thank Caitlin Ward, our legislative liaison, for her support this session. If there are any questions, I'll be happy to answer them at this time.
Any questions from board members or comments for Brandi? Hearing none, I'd like to add our thanks to Brandi for that comprehensive update today and the work that you and your team have done during the legislative session. We appreciate that very much.
Chairman.
Thank you, Brandi. Are there anyone know of any new business that needs to come before the board at this time? Hearing none, I would comment that August, I believe, and Commissioner, correct me if I'm wrong, I believe in August we have 2 meetings scheduled. That is traditionally, I think the next one is on August 13 at 10:30, and as in the past, I believe the subject for that meeting is exclusively or almost exclusively probably the state health benefit plan. And then the later meeting in August, which is the 27th, typically is our budget meeting. Am I correct on those things?
Yes, sir.
Okay. Did anyone know of any other business that needs to come before the board at this time?
Commissioner Boyd, I just want to let you know that I had voted yes on all of the resolutions. My mic was muted by the host, and so I could not respond.
Oh, thank you. Thank you, Roger. Thank you. Any other comments? Hearing none, the meeting is adjourned, and thank you all very much for being a part of the meeting today.
Y'all have a good day.
Thank you.
Thank you.
Thank you all.
Good one.
Very much.